Okay, teeth to teeth, S and Z. And as I mentioned earlier, the S sound is the one that I find the most common problem. And there are a couple fixes for that. So I'm sure many of you have had the same issue with the S sound. It's probably, again, the hardest one, maybe not the hardest one to solve, but the most prevalent one. And this is because a hybrid of prosthesis affects so many aspects of forming this S sound. Airflow under the appliance, it has to be controlled. So once surgery is done, usually we have some ridge contact with the appliance to the tissue. And but as the patient heals, that space begins to open, and the S sound is something that they find is more difficult to pronounce. So that means that initially, if the S sound was good, and as time goes by, the S sound becomes something they struggle with, usually it means that there's the space between the tissue and the intaglio surface of the hybrid is open too much, and that needs to be filled. They'll complain of saliva going through there or air, and also, the sound of the S and the Z isn't something that they can master. So just by simply filling that gap underneath, as you see in the top of the picture on the right, at the border, that can go a long way to solve these problems. If the patient has had this long enough and you feel comfortable removing the appliance, you can actually do a reline on the intaglio surface and correct it that way. And that's, a pretty simple way to do it. And it's, however you do your relines, you simply take the appliance off, put some material in place, reseat it, or you can take an impression on the intaglio surface, take it out, make a model, and do your reline that way. And that will give you a perfect fit to the tissue and usually solve the problem of the S real sharp S sound or the whistling sound that people get. Whistling is not uncommon with provisional since air passes under the bridge during speech. And most of the time it's on the upper where that problem exists. So how do we correct it other than filling the gap on the tissue is if there is too much contact, a lisp can occur. So too much contact with the incisal edges. So in other words, a patient bites down and they actually bite, or they go to say S or Z, and their anterior teeth actually indent themselves into the lower lip. So you might have to adjust the incisal edge of the teeth. If the maxillary anteriors, if the anteriors are in the correct aesthetic position, then sometimes shortening the mandibular teeth can help, or some sort of vertical dimension change. If the maxillary teeth are too long, shorten them up a little bit. Now, if the maxillary teeth are good and the lower teeth are too short, those can also be lengthened with composite right there, chairside, and have the patient just repeat 66 until the sound is correct or as close as you can get it to being correct. So, also, if the opposing arch, the lower, is a natural, our natural teeth, and as the teeth, if there's no contact initially with the lower teeth, if they super-erupt and the lisp returns, sometimes you might have to make sure that there's contact between the upper and lower incisal edges. So that's just another test you can make to try to correct the S or the Z sound.